Sponsored by Lange Eye Institute and Fortify Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 877-969-8600. That's 877-969-8600. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host as usual, Dr. Michael P. Lange of the Lange Eye Institute and Fortify Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, and a nutritionally related topic. So remember, this is a live call-in show dedicated to you, the listener, the consumer, the viewer. So no matter how simple, like I said, pick up the phones at 1-877-969-8600. That's 1-877-969-8600. If you're new to the program, you know, we're broadcasting through a variety of networks all over the world globally. And so it's really good morning, good afternoon, and good evening, just depending on where you're picking up the show. So if you're new to the program, I am a board-certified optometric physician. I'm also a certified nutritional specialist. I founded Lange Eye Care and Associates March 15th of 1993. Started hosting Ask the Doctor April 15th of 1993. So over 30 years I've been hosting this program. Started on a small AM radio station in Ocala, Florida, thanks to Country Jim Kirk giving me an opportunity. And we've expanded to a syndicated radio show that is really global now. So tune in, listen, watch us on social media. A lot of you are chiming in, I see, on Instagram right now. I've heard that our restream is down right now. So Facebook and LinkedIn and places like that, YouTube, are not picking us up right now. But we might be able to fix that shortly. But you can watch us on Instagram all over the world. And we got a lot to talk about today. We've got my very welcome guest and co-host this morning, Dr. Susan Summerton, with me today. Susan, why don't you introduce yourself and tell us a little bit about you?
Good morning. Happy to back on this beautiful sunny day. Finally, we have here in the Villages. I'm happy to join you not only as a colleague in Lange Eye Institute, but also with my background in being an eye doctor and also a nutritionist. I'm also a certified nutrition specialist. I'm a diplomat with the American College Board of Nutrition and a fellow in the Ocular Wellness and Nutrition Society.
Yep, and I'm going to toot your own horn. You're the only one in the state of Florida with all those credentials, and you're at the Lange Eye Institute in the Villages, Florida. So the Lange Eye Institute is a state-of-the-art eye care center. We've got the latest of the latest in technology. We just installed the new Zeiss Claris, and the new latest Optomap California is going to be in on Tuesday. So we're continuously expanding our technology. If you'd like to see Dr. Summerton for an eye exam at the Lange Eye Institute, I'm going to give you the phone number twice. Here it is, 352-753-4014. That's 352-753-4014. That is the Lange Eye Institute in the Villages, Florida. And also, you can learn about everything we do with nutrition at our vitamin company, Fortify Vitamins. That's fortify.com, Fortifeye, fortify.com. All right, I got a message. YouTube and LinkedIn is working right now. All right, we're just down on Facebook, so that's okay. Better on some than none, right? So the phone number for Fortify Vitamins is 866-503-9746. One more time, Fortify Vitamins is 866-503-9746. But check us out on the website at fortify.com. I do want to introduce, before we go to the first call, and I got to tell you, the first call is a new first caller because Bob did not get in early enough this morning. So we got a new first caller, which is going to be interesting. But the new BOGO that we have on Fortify Fit, we've been running that BOGO for a few months now. It's buy one, get one free on the Fortify Fit Strawberry Watermelon Cream. It goes away Sunday at midnight. So we're not running that BOGO anymore. So we did it for an introductory offer for our new Strawberry Watermelon Cream. A lot of you have taken advantage of that. If you want the Strawberry Watermelon Cream Fortify Fit, get it before Sunday on the website at fortify.com or come by Fortify Nutrition Center today in Clearwater. By the way, I'll be there from 1 to 3 at the Fortify Nutrition Center in Clearwater talking to you guys and gals about nutrition. So the BOGO goes away at Sunday at midnight. All right, let's go to the phones. I think it's Gino in Indiana. Good morning. Welcome to the program.
Hello there, doctor. How are you today?
Fabulous. And yourself?
Okay, I got one or two questions to ask you. You sent me those Oasis eye drops, and they're fabulous. I'd like to tell you that. Okay, and the other, well, I take your fit all the time. So anyway, I'm going for an operation for a basal cell carcinoma sunburn. So what's going to happen is I have to get an operation on it, and I won't be able to be exercising. Can I still take the fit and the protein?
Absolutely. You continuously take the fit and the protein. Now, before you have any surgery, I usually recommend about 5 days before stopping any vitamins at all. Okay.
Okay.
Because lots of vitamins, especially things like ginkgo biloba and garlic and curcumin and ginger and boswellia, these have some blood thinning properties. Even omega-3 and high dosages have some blood thinning properties. So it's not a bad idea to stop all vitamins 5 days before, just to err on the side of caution, making sure that you heal up quickly. But you can start them right after surgery. You can start back.
Okay, doctor. I appreciate you very much, and Dr. Hall too.
Well, Gina,
and I'm still walking though, and I'm still exercising until I go to the doctor and get that operation. And I'm taking the fit and the protein, super protein. Now I'm going to ask you another question about that super protein isolate. Does that have the mother lobe in it?
Did you say the mother load?
Yeah, like I forgot that. I forgot what it was.
Well, I might enlighten you. It has the covalent bonded cysteine that converts to glutathione, the lactoferrin, CLA, and immunoglobulins, all in that whey protein isolate. And that's grass-fed whey isolate, and that's from the UK. And our whey concentrate is called our Fortify Super Protein. It's from New Zealand, and it's a concentrate, not an isolate. And you probably know the differences. It's one has a little fat in it and one doesn't.
Yeah, I got the isolate from you, so I'm going to start using that too after my operation, okay?
All right, awesome. Good luck, Gino, and give us a call back and let us know how you're doing.
I will. Your eye stuff is fabulous.
Thanks. I appreciate that, Gino. Take good care.
God bless you, and thank you for having me.
All right, bye-bye. All right, we got a lot of people loading up on the show. I just want to mention that Dr. Hall and I and Logan Lange just got back from the International Sports Nutrition Conference in Fort Lauderdale. We were there Thursday, Friday, Saturday, and Sunday of last week. That's why we had to run a tape. And it was a big hit. Fortify Vitamins, our whole performance line, our Fortify Fit, all of our proteins, our Focus and Brain, our Gamer Extreme, all of that was just a huge hit at the conference. And also, we're doing another conference next Saturday, and I'm inviting everybody to come out to it. It's in Orlando. So a lot of you guys and gals are really near Orlando. It's called the USA Fit Games. All right. We'll be there from 8 in the morning until 10 o'clock at night on Saturday. And that's July 1st. And that's at the Orange County Convention Center. And it's booth number 407 and 408. So we got two booths. And that's going to be me, Logan Lange, Dr. Hall, my wife, Tammy, Arlene from Fortify Vitamins. So we'll be closed at the Fortify Nutrition Center next Saturday. So come on in this Saturday. But that's the USA Fit Games, Orlando, July 1st. That's next Saturday, booth 407 and 408. Come on out, talk to us. I'll be giving some great deals on all the Fortify products at that show. All right, we're getting ready to go to the next call. Then we're going to talk with Dr. Summerton about some late-breaking evidence with glaucoma. And this is really new. But let's go first to, I think it's Jerry in Citrus County. Morning, Jerry.
Oh, good morning, Dr. Lange. I got a question for you. Recently, our neighborhood has had several people with eye strokes. What's the cause of that? And the treatment, and is there a prevention or anything?
Wow. Yeah. So eye strokes can be a variety of things, Jerry. As we get older, we worry about things like ischemic optic neuropathy. Okay. And there's different types of ischemic optic neuropathy. There's arteritic and non-arteritic. And this means most people, when they're over 60, will get an ischemic optic neuropathy that's non-arteritic. And that means it's usually related to high blood pressure, diabetes, atherosclerosis, elevated cholesterol, things of this nature. But there's a type called arteritic ischemic optic neuropathy that's related to something called giant cell arteritis. And this is when people that have rheumatoid arthritis or polymyalgia rheumatica, these type of collagen vascular diseases that are more prone to developing arteritic. And arteritic is when you have a painless loss of vision, usually sectoral loss of vision, like a altitudinal, above or below, and sometimes total blindness. That's a medical emergency, and it needs to be seen immediately because you can go blind in the next eye in 24 to 48 hours. And the treatment for that is high dosages of IV steroids. So that's why it's important to see your eye doctor annually or per their instructions. Other types of strokes to the eyes are what we call branch vein occlusions and artery occlusions. And these things are also related to vascular problems. So in a nutshell, as we mature, we need to try to get in the best shape of our life. We need to get to our ideal body weight, control our triglycerides, C-reactive protein, cholesterol. And we can do that through diet and exercise, the right supplements, okay? And obviously following your doctor's advice as well. So there's a lot of different types of strokes to the eye. And I'm going to let Dr. Summerton chime in and add a little bit to that.
Thank you.
Well, I'm back. Dr. Lange, I had some technical difficulties. I was off the line, so I apologize. I missed what you were talking about.
Okay, so we were talking about, Jerry asked about a lot of people in his neighborhood are getting strokes in their eyes. And I was talking a little about how it can be ischemic optic neuropathy, non-arteritic, arteritic versus vein occlusions and artery occlusions. And I just wanted you to chime in a little bit as well.
Yeah, the point of the eyes are not just your vision. The eyes are, people say it all the time, windows to your soul, so it can reflect the health of the rest of your body. So it's important, not just with the eye exam for knowing about eyeglasses, but we're looking with our new equipment that we can see all those blood vessels. We can see the nerve that goes to the brain. We can see the oxygen that flows there. And, eyes are connected to your brain. Your brain's connected to the body. So we want to improve overall health to improve eye health.
Yep, absolutely. Now, Jerry, what about you? How's your eyes?
Pretty good. I got the dry AMD, but it seems to be stable from what I heard last.
Good. Very good.
On there, but I got concerned about this because it seemed to be a rash of something. I don't know what the cause was, other than now you've given me some guidelines here to look into. I am containing pretty good health. I take some of your vitamins on there, but just looking in. But the most common one is that non-aortic or whatever it was.
Yeah, non-arteritic ischemic optic neuropathy. And, I got to tell you, a lot of our listeners out there, especially in the villages, are taking, ED drugs, erectile dysfunction drugs, things like Viagra and Cialis. And you got to be very careful with that, all right? Because these drugs can also cause this type of ischemic optic neuropathy. And I see it happen a lot of times. So, don't just be swapping with your buddy next door. Make sure your physician okays it and you use it per the instructions. More is not better, okay?
Yeah, I don't know about that in the neighborhood here. Some are ladies, so I'm not sure if they take stuff like that or not. But the thing of it is, I don't take any of those drugs. I'm too old. On there. So now that you gave me the terms and the technical stuff, I can look up a little deeper into it. And I appreciate that, Dr. Lange.
My pleasure, Jerry. You have a good one.
Good one. Bye.
Take care. And talking about macular degeneration and nutrition, Dr. Summerton just did a lecture, not too long ago, about 2-3 months ago, to about 300 doctors from all over the country in Destin. And what was that topic that you were lecturing to doctors about?
We talked about all different nutrients that can benefit the eye health. One of the things we sort of lack in our medical optometry school training is the nutrition background. So it's a big pleasure to be able to go to these conferences and talk to doctors about it so that they can then teach their patients about how diet and what you eat affects not your eye health.
Absolutely. You are what you eat. And that's one thing I love about Dr. Summerton is she's educating not only our patients, but doctors from all over the world. And that's why we like doing this radio show as well. And both of us are certified nutritional specialists, which is pretty rare in the optometric community. All right, phone lines are open. If you got a question, give us a call at 1-877-969-8600. That's 1-877-969-8600. We're getting ready to take another call in just a second. So Mary, just hold on for just a second. I want to talk about real quickly a nutrient, and we're going to expand on that with Dr. Summerton in a minute. But there's one nutrient that I always tell people, if you only took one nutrient, only one nutrient, what would it be? It would be omega-3 fish oil, and it would be the triglyceride form or the reesterified triglyceride form of omega-3 fish oil. And that's like our Fortify Super Omega or Fortify Super Omega-3 Max. Now, there's other products on the market that are similar to it, but there's not any that are less expensive and more potent. Literally, we are the least expensive, most potent reesterified triglyceride form in the industry right now, if you do a search. And so there are three things that can be beneficial, actually four things in the eye: dry eye, macular degeneration, now maybe glaucoma, and also, what was the other one? Macular degeneration, glaucoma, and dry eye. And there was something else biting at the bit, and I can't think of what it was. But we're going to expand on that in just a second. We're getting ready to go to the next call. Let's see. I think Mary's been waiting patiently. Mary in Seminole, good morning. Welcome to the program.
Hi, good morning, Dr. Lange. What I'm calling about, did I hear you? I thought I heard you say that the Fortify Fit strawberry watermelon cream can be used even if you're not an exerciser. The only exercises that I do is some back stretches, yoga-like things, pretty much every day for about 30 minutes, 45 minutes.
Oh, absolutely. And, I would do it right after you do your stretching or after you go on a walk, but you don't have to exercise. I mean, there's studies that have shown that the ingredients that are in Fortify Fit can help with muscle tone and strength, even if you don't exercise. Now, obviously, exercising is very important, but these nutrients can improve circulation. They can take these nutrients to all parts of the body, including the brain. And there's a lot of good science now talking about astaxanthin and the creatine that's in it to help reduce cognitive decline and neurodegenerative diseases. So not only is it good for your muscle, your skin, your ligaments, your tendons, your joints, but also your brain. And remember, we have collagen in this as well. So the collagen helps the scaffolding, and then the branched chain amino acids and the beta anhydrous and the creatine and all the other nutrients help the muscle. So it's one of the only supplements on the market that can be used pre-workout and post-workout that not only helps the scaffolding of the body, but also the musculature of the body, and potentially can help, support brain health as well.
So you don't, I take so many supplements and I don't think I could take it right, because I do, and I have GERD and all this other stuff. So I do my exercising stretches in the morning on an empty stomach. And I don't think I could take this then, I have it already, but I'm looking at the ingredients and there's some things in here I'm afraid, what if I can't take it because of all my sensitivity?
So what I would do, I would try, getting some coconut milk or hemp milk or cashew milk or even A2 cow's milk or goat's milk, and just take a quarter of the scoop first, not a whole scoop, just a quarter, and just put it in that fluid and mix it up and drink it down. And just start, because you're a little apprehensive and could be a little anxious. So if you do a quarter, I guarantee you're going to be fine. It's not going to cause a problem. And if it does cause a problem, then you're going to be happy you didn't take the full scoop, okay?
And then what do I do?
Well, then gradually, the next time you take it, instead of a quarter scoop, take a half scoop. Then the next time, take 3/4 of a scoop. And then the fourth time, take the full scoop, because most people take 2 scoops a day and have no problem at all. So I would try just weaning into it carefully just to make sure you do okay with it.
Well, the other apprehension is the fact that when I was using the isolate, and when the switch was made from the cows, I don't know if it was the cows or the container that it's in, I can't take it now. I have this sensitivity to it.
Huh. Yeah, the only thing, we switched it from the container to the bag, but basically, there's still a grass-fed whey protein isolate, non-denatured, so that's been the same. And you might want to try that again, the same thing, just to 1/4 of a scoop.
Let me ask you about the coconut milk. I looked at coconut milk in the health food store,
Mm-hmm.
and they have the coconut milks on the market that I see. They have all kinds of additive kind of things in it.
Right.
Which is there a brand that you recommend or that you use?
Yeah, at Whole Foods and Sprouts and places like that have some organic coconut milk that's not filled with all the carrageenan and all the stuff that's bad. And the same thing with almond milk and cashew milk. The main thing you want to look at is make sure there's no carrageenan in it. Carrageenan is very bad for irritable bowel, and it's not the best thing in the world for our digestive system. And of course, no sucralose or aspartame, any of the artificial flavors or dyes. So try to find an unflavored coconut milk, preferably organic, unflavored, and you should be fine. But I'm glad you're reading labels.
I can't buy anything without reading a label.
Good for you. Excellent.
Well, anyway, I guess if I can't, I still try your recommended use of this product. I guess I can pass it on to a relative or somebody.
Well, you can, but try it. Try the 1/4 of a scoop and mix it up with something that's tolerable for you, and I bet you do fine. And then let me know, okay?
Well, probably the best thing for me to use would be just water.
Okay. Do some good spring water.
Right. Yeah, I use the Zephyr Hills spring water.
Perfect.
Okay, thank you for your answers and your help here. I've been listening to you for many years.
Oh, thank you. My pleasure. You have a great day.
I think since you came on the air, and it's about shortly after I moved here.
Wow. Yeah, I've been on for 30 years, so you've been a loyal listener.
Yes, I have.
Thanks.
Thank you.
Bye-bye.
Bye now.
All right, we got a lot of people on hold, but I want to mention something before we take the next few callers. There's a recent study, and actually Dr. Summerton brought this to my attention, a recent study talking about diglycerides and triglycerides. If they're elevated, it may increase your risk of glaucoma. And so I've been thinking about that, and I've been recommending omega-3 to my glaucoma patients for a long time. And when you think about it, omega-3, especially in the triglyceride form, is one of the best ways to lower triglycerides, okay? Obviously, diet and exercise are important too. But, Susan, why don't you expand a little bit on this as well? I mean, this is some new science, and now we have a little more in our arsenal to help people naturally that may be, a glaucoma suspect.
That's one of the things we hadn't really used so much before was the fish oil in our glaucoma patients, specifically for helping them lower those fats. But the study that just came out that said those patients that had glaucoma have higher levels of triglycerides and diglycerides. And they think, we're not exactly sure, but we think it's because they cause that inflammation and oxidative stress, and that can lead to the damage of that optic nerve, which then can lead to the loss of that peripheral vision. So now I want to bring people's attention because it's a little bit confusing. When we say take the fish oil, we do say triglyceride form, but that is not the same as triglyceride fat. It's the way the fish oil is absorbed. And those good studies where we see fish oil effective, they're always the triglyceride form, and they're also the dosage matters. So in studies that fail, it's either because they've used the wrong form or because they haven't used enough. We want to stay away from the ethyl ester form, and it's not always labeled that way, so you have to be kind of careful. But the ethyl ester I kind of refer to more as like a fish oil concentrate rather than true fish oil. It's sort of semi-synthetic because they combine ethanol with those fatty acids, and we really don't want to add that to our bodies. So when you look at it, that's why on our fish oil for Fortify, it'll say TG on there, and that's important to look for.
Right, the TG form, because when they make fish oil, they use ethanol in the distillation process and the concentration process, and then they don't take it out because it's expensive to remove it. And we go through a phase called transesterification in Norway, in Oslo, Norway, and it develops the purest, most pristine omega-3 fish oil. Companies have tried to match this all over the world, and they just can't. When you look at our COA, you can see there's virtually no contaminants. I mean, 0.000012 or whatever it is. And you look at other people's COAs and you'll see that their contaminant levels are much higher. So the Norwegians are kind of like the Bordeaux region is, the French Bordeaux region is to wine. The Osland, Norway guys and gals over there in the fish oil industry are the ultimate for purifying and concentrating fish oil. And like I said, it's reesterified triglyceride form. So look for RTG or TG form. And that's Fortify Super Omega. You can look at all the science on the website at fortify.com. All right, let's go back to the phones. I think Sherry has been waiting patiently in Fort Light. Sherry, good morning.
Good morning. I want some information about specifically what supplements I should take. I have had 2 strokes, one of them just a month ago, and the first one I lost most of my left peripheral vision. I do have high blood pressure. I take meds for that, including a statin, and I'm on a blood thinner, Plavix. Regularly, I take D3, C, and hyaluronic acid. Any suggestions on what's the best things for me?
Well, just, without seeing you as a patient, it's hard to know without looking at all your blood chemistries and everything else. But just off the bat, I think you probably need to add some CoQ10 since you're on a statin drug. All right, CoQ10 would be a good idea, and probably 100 to 200 milligrams, just depending on if you're a heavy woman, 200 milligrams. If you're not heavy, closer to 100 milligrams. But also, omega-3 is probably not a bad idea. Anybody that has lipids that are elevated or history of lipids that are elevated, whether they're triglycerides or cholesterol, omega-3 has been shown to actually improve the cholesterol ratio, lower triglycerides, lower C-reactive protein. So taking a good omega-3 fish oil or eating some good quality fish, and the good quality fish are wild Alaskan salmon, sardines, anchovies, mackerel, and herring. And believe it or not, fish roe, like salmon eggs, is very good for you. So if you're one of those individuals that is not going to consume the right amount of fish, if you're not going to eat one of those fish I just mentioned 3 times a week, then you may want to consider taking a triglyceride form omega-3 fish oil, whether it's our Fortify Super Omega or it's something similar. At least go to our website, look at the ingredient profile, then you can find something like that. If you can find something like that, at a local health food store or online, or you can certainly order ours. And then also, obviously, consulting with your physician is a good idea. You're on a blood thinner, so you don't want to be on things that thin your blood out a lot more or thicken the blood a lot more. So just one of those super omegas a day is probably adequate, and you'll probably be fine. And you're the typical patient that I see. Most of my patients are, I don't know how old you are, but most of my patients, actually, my average age patient is about 80, and you don't sound anywhere near 80. So,
I'm 70.
Yeah, so you're still a young thing. And they're diabetic with high blood pressure. They've had vascular conditions. They have macular degeneration, diabetes, glaucoma, dry eye, cataracts. So I deal with, this type of patient on a daily basis. And that's one of the reasons I developed the Fortify vitamin line, to try to give, nutrients that people are not getting in their typical diet. Now, if we all ate a diet consistent with the Lange survival diet, and we all ate 10 to 13 servings of organically fruits and vegetables a day, exercised, had no body weight, 30 minutes of sunshine, plenty of sleep, and ate the fish per my instructions, maybe we wouldn't even have to take any supplements. But, quite frankly, most of us are not going to do that. Most of us are on the typical SAD diet. That's an American diet, SAD diet. And, we're into the convenience factor. We want something fast. We can nuke in the microwave. We can pull through the, fast food restaurant. And, these foods aren't ideal for our overall health. So there's no time like the present for anybody listening to us to make a change. I think there was a study that came out and said that if you make a change in your diet, an aggressive change in your diet, even if you're 60 years of age, you can add 8 to 12 years to your life by making a change at 60 years of age. And if you change it earlier, then maybe even a longer expanse of time.
Well, it's the best thing for me to do. Come see Dr. Hall, bring all my medicines and see what he has to say.
Absolutely. Bring your bag of medicines and vitamins. Come to the Lange Eye Institute for a free nutritional consultation with Dr. Hall. And you can certainly see on the same day, you can see Dr. Summerton, Dr. Caputi, or myself for an eye exam. Remember, the eye is the window to the body. So with this new technology we have, the new OptoMap, the Zeiss Claris, the OCTs, we can look at the vascular system and we can see the arteries and the veins and the capillaries, whether or not you have any plaque building up in there. So not only are we looking for the first signs of eye diseases, but some of the first signs of systemic health problems actually manifest in the eye. So an eye exam can be life-saving, believe it or not.
Okay. I also have optic migraines quite frequently.
So ocular migraines. Dr. Summerton, you want to chime in on that a little bit?
We do see this quite often. That's where people have those vision disturbances. It's similar to those who've had classic migraines when they're younger and they get, we call this like vision aura, and then it comes the whopping headache. But later in life, it often turns into an ocular migraine where you see, and it is quite disturbing when it happens. It happened to me when I was pregnant. One of the things that I typically recommend right away is a chelated magnesium to take. And many people are short of magnesium. It controls so many enzymatic actions in our body, important for most of us to take. A lot of the drugs that people take, that complete magnesium. But magnesium works with calcium. Magnesium is what kind of relaxes everything, and calcium traps everything. So if you've got the two in balance, you see side effects of things that spasm with your blood vessels spasming when you get that ocular migraine. So it's good to make sure magnesium comes from eating plants. Plants get it from the earth, but our cells are deficient in magnesium, so our plants are deficient, and we become deficient. So a good chelated magnesium added to your regimen can help.
And then also keep a diary. Anytime you have this ocular migraine, write down what occurred 30 minutes prior to having this ocular migraine, and whether or not you were eating anything that has MSG or artificial sweeteners, drinking coffee, beer, cheese, wine, anything that's been aged, any petroleum fumes or perfumes. And sometimes there's a trigger mechanism for an ocular migraine. Then you can simply eliminate that from your life and never get them again. So try to keep a diary as well, and make sure you're hydrated, okay? Because dehydration can also be a trigger for all sorts of things, including ocular migraines. So, and a good eye exam. Have your eyes dilated. Make sure your retina is healthy as well, okay?
Okay, so if I come down there for an eye exam, I can see Dr. Summerton and the whole bit all in one day?
Yes, ma'am. Absolutely. So what you do is set up an appointment to see Dr. Summerton and Dr. Hall. So you see Summerton first, and then on the way out, you sit down with Dr. Hall. And Dr. Hall is a free consultation, and your insurance is probably going to cover Dr. Summerton.
Okay, wonderful.
All right.
Thank you.
Take care, Sherry.
Bye.
All right. You're listening to Ask the Doctors, Dr. Michael Lange and Dr. Susan Summerton. If you got a question, give us a call at 1-877-969-8600. That's 1-877-969-8600. We're getting ready to go back to the phones. I do want to mention the Lange Eye Institute and the Villages. We have the largest selection of optical in the area by far. And I just want to mention, we got Cartier in now. A lot of people are on the list. A lot of you like the ultimate and designer eyewear. You're going to pay a premium for it. But the only other place you can get Cartier is down in South Florida. So we have Cartier, the entire line of Cartier at the Lange Eye Institute. We also have Gucci, Coco Song, Jimmy Choo, Tom Ford, Lafont. Those are handmade French eyewear. Christian Dior, Chloe, Saint Laurent. And all you women know Saint Laurent. And it's the ultimate in designer eyewear. Mont Blanc, and a lot more. Certainly all the sunglasses like Maui Jim we have as well. So come on by the Lange Eye Institute. Check out our eyewear department. All of our opticians, we have actually five opticians, including in the lab and on the floor. They've all had years and years of experience. Many of them have been with me for 30 years. So when you're spending a lot of money on a pair of eyewear, you don't want to have somebody that worked at the fast food restaurant the week before taking your measurements. Now, do you? All right, let's go back to the phones. We're loaded up. Let's go to Barbara in Palm Harbor. Good morning, Barb.
Oh, good morning, doctors. Yes, I would like to have elevated liver enzymes addressed, and also what is a good treatment for severe GERD?
Wow, that's a tough one. So elevated liver enzymes, I mean, can be a whole host of things causing that. I mean, a lot of our elderly patients have elevated enzymes related to the medications, believe it or not, that they're taking. GERD, I can address. I'm going to let Dr. Summerton maybe can expand a little bit on elevated liver enzymes better than I can, but I'll become an expert for the next show. Dr. Summerton, you got anything on that? Because I just don't have a lot on it.
It is hard because there are so many reasons for it. So it's really figuring out what the reason is. But like you said, some of these, even these over-the-counter medications, Tylenol and things like that, that can cause elevated liver enzymes. So it's looking what you're putting into your body that might be affecting it. But I know right off the bat, when I think liver, I think of beets, because your liver loves beets, and adding beets into your diet can really help liver function.
Right. And what about GERD? Do you know a lot about GERD?
Well, I think with GERD is just one, making sure you have a good probiotic is good gut health. And sometimes people think it's lowering the acid, but then it also could be the opposite. It could be you actually need to increase the acid in your stomach. I know personally, I was into really drinking a lot of the alkaline water, and that started happening to me. So the way I fixed it, I had to change liver.
Yeah, and a lot of people with GERD are going to benefit, believe it or not, and this is where weight management comes in. So weight management is crucial, because if you're overweight, if you're in any type of obesity, it aggravates GERD. And so when you're sleeping at night, especially if you're over the weight, put a few pillows under your head and you'll do better at less GERD. And a lot of people are smoking. Smoking, makes GERD like 5-10 times worse. And so diet is crucial, because that helps us to take our weight off. And using a diet, here we go again, consistent with the Lange survival diet, because the lion's share of the food that we're eating is filled with gluten, lectins, protease inhibitors, phytic acid, oxalates, things that are very bad on the lining of the gut. All right. And then some of the typical dairy that we're drinking has an A1 beta casein in it that also aggravates GERD. So, we got to take the bull by the horns, proper diet, look at the Lange survival diet. Weight management is crucial. And of course, there's lots of medications that people can take: antacids, H2 blockers, proton inhibitor. Those are called PPIs. And all these medications, I don't love them, because oftentimes if you're doing something that's decreasing the acid, then your body will secrete more acid to counteract the medication. You got to continuously take these medications. So I love to do it naturally, as natural as possible. I would also recommend eating some enzymes, taking enzymes before your cooked meals, chewing your food 30 times, all right? Don't drink any water with your meal or any fluids with your meal, because that's going to dilute the hydrochloric acid, the enzymes, the probiotics in your gut. So chew the food, let your saliva start to act on the amylase enzymes, start to act on it immediately. And then follow up, 20, 30 minutes later, you can drink some water. Now, obviously, some people got to drink a little water just to make the food go down, but don't overdo it. Take a good probiotic like the Fortified probiotics, and I recommend that at bedtime or first thing on the morning on an empty stomach. Be careful taking anything that has extra acid in it. like hydrochloric acid, HCl capsules, because you don't know exactly how much to take. And I've seen too many people take too much acid and expand the problem even further.
Okay, and a good liver detox, milk thistle. I know. Any other suggestions for a really good liver detox for elevated liver enzymes?
Well, yeah, that's I'd have to research that a lot more to give you a good answer on that. I'm just not an expert in that area. Alcohol, obviously no booze. If anybody has any elevated liver enzymes, any liver problem, you got to get off all the alcohol, not even one glass of wine. What about detoxing? Susan, you got anything on that?
Well, the food that you mentioned, the greens in the violet, it, asparagus, Brussels sprouts, even avocado is a good liver, is good for your liver. If you like, you're not a big fan, but it's something that we could all benefit from eating.
Yeah, Susan, you're breaking up a little bit. We don't have a great connection. If you're on your cell phone, maybe go to a different room. And Barb, I think we're getting loaded up on some more calls. Barb,
I got the gist of it. Thanks so much, doctors. Thanks.
Thank you, Barb. Thanks for the call. All right. Once again, you're listening to Ask the Doctors. Check everything out on our website at fortifeye.com. FORTIFEYE. Fortify.com. Remember, it's a play on words since I'm an eye doctor. And the phone number for Fortify Vitamins, I'm going to give it to you twice. And we are open today until 3 o'clock at the Fortify Nutrition Center. So the phones are being answered. The phone number for Fortify Vitamins is 866-503-9746. That's 866-503-9746. If you go to the website, look at the bundle section and look at the digestive bundle. So the digestive bundle, we give you our enzymes and probiotics for a really good deal. So that's something to think about. And also remember, our organic blue-green superfood has digestive enzymes, probiotics in it, as well as gluten-free and FODMAP-free. That means that those of you with IBS can take that organic blue-green superfood. All right, I don't know who's next. We're loaded up with about 10 calls, so let's go to Mark, I think, maybe, and St. Pete first. Mark, good morning.
Good morning. I have a question about a supplement I take. I don't know. Is it okay to mention the name of the company?
Sure.
It's from Life Extension. It's called MacuGuard. I was wondering if you're familiar with it, and if you are, what your opinion is on it.
Absolutely. I am very familiar with it. I'm familiar with the company. It's a good company, and there's nothing wrong with MacuGuard. There really isn't. It's a good product. It's ahead of the curve from the typical eye supplements out there. Now, obviously, I'm a little bit more biased to our Fortify Next Gen Macular Defense or our Fortify Next Gen Complete. That's the newest one you can check out on the website. It's called Fortify Next Gen Complete. Look at that and just compare it to the MacuGuard. There's nothing wrong with MacuGuard. It's a cut above most of the stuff out there. It really is. But, the whole idea behind Fortify is to take it even to that next level. So compare the prices, compare the ingredient profile to our Fortify Next Gen Complete and see what you think. But I think it's a good product.
Great. Well, thank you very much. And I love your show. I've been listening to it for a long time. I appreciate your help.
All right, Mark. Thanks. And
Bye.
for those of you that are going to be listening in Philadelphia soon, we're going to be on a new station in Philadelphia, one of the largest radio stations in Philadelphia. As a matter of fact, starting next week, we're going to be on the Philadelphia radio station. So welcome, Philadelphia. I lived on Roosevelt Boulevard in Corman Suites. So I'll have fun talking about Philadelphia coming up in the shows in the future. And also, Los Angeles wants us on a big radio station in LA. They're a bit pricey, so I'm trying to negotiate on the fee because LA is a big, as you know, big. So LA and Philadelphia will be there very soon, listening to Dr. Summerton and myself, Dr. Lange, and of course, Dr. Hall every other week as well. All right, we're going to Eleanor. She's been on hold for half the show. Eleanor in Summerfield, good morning. Welcome to the program.
Good morning. Thank you for taking my call. I have a question about Vascepta, Vaspea. It's a fish oil, but it's by prescription. Is that okay?
All right. So yes, ma'am. Vasepa is there's two fish oils that are prescription fish oil, Lavazza and Vasepa, and there's another one out there too. And Vasepa, if I recall, is the EPA portion of the fish oil. Doesn't have the DHA in it, and it's for people with elevated lipids, and it's prescribed by your doctor. And I would say if your doctor is prescribing this, then it's probably a good idea to take it. However, it is the ethyl ester molecule. It has ethanol attached to the backbone, and it's relatively expensive. So I would look and see what your price is for the amount of money that you spend and how much they give you, and then compare it to something like our Super Omega-3 Max, okay? Our Super Omega-3 Max, if I recall, has almost the same amount of EPA, but we have DHA as well, and that's also good for you. And it's the triglyceride molecule. So studies indicate the triglyceride form absorbs about 3 times more readily than the ethyl ester molecule. But once again, do your homework, look at the ingredient profile, and then compare it to Super Omega-3 Max by Fortify and see if the EPA is the same level or close to it and the price is less. Then you may consider it, but talk with your doctor about it first and say, look, this is a product that, I know Dr. Lange developed it. What do you think about it? Can I switch to this if it's a big savings? If he says absolutely not, then follow your doctor's instructions.
I love your show and I love you. Thank you. God bless you.
Oh, thank you. And I love you too. I'll get in trouble if my wife's listening. But my wife's in Nashville right now with my daughter at Vanderbilt. Mackenzie's doing another week at a pre-medical school summer camp at Vanderbilt. So I'm trying to push her into that area. She'll be a senior next year here at Calvary High School in Clearwater. All right, let's see. We're getting loaded up still. Let's go to Steve. We got time for a quick call from Steve. Good morning, Steve.
Yes, and it'll be quick. Tell Barbara, she called about liver,
right?
That most of the liver toxins that are produced in the liver are detoxified by methylation. And so lipotropes, which are choline, betaine, and methionine, have her Google, just put 2 key words in, lipotropes and liver. Lipotropes and liver, and that'll give her the information.
Oh, that is awesome, Steve. And that's genius, Steve. And Steve knows what he's talking about. Let me tell you, I've known Steve for a long time. He's been a caller for a while and a friend. And Steve, that's why we call him genius, because literally, I don't think they can even measure your IQ.
Okay. Very good.
Steve, thank you.
Have a great day.
All right.
Okay.
You too. All right. I want to mention before we're gonna chit chat with Dr. Summerton briefly, but I want to mention Dr. Patrick Watson. He is a neuropsychologist and he has Mindset Solutions in Ocala. Dr. Patrick Watson, a good friend of mine, a good friend of the show's. He does integral clinical hypnotherapy. This hypnotherapy is for stress, anxiety, depression, PTSD. If you're overweight, you have problems with your bladder, you have any phobias, you're afraid to get in a elevator, anything like that, you're afraid of your wife or your husband, he can hypnotize you. I want you to check out his website, mindsetsolution.net. It's actually Mindset Solute, SOL.net. So mindset and then SOL.net. He does free consultations and he also can do it remotely over the internet or via the phone. Let me give you the phone number for Dr. Patrick Watson. He's in Ocala, upstairs in my old Lange Eye Care building, right across the street from the Paddock Mall upstairs. His phone number is 352-789-9133. That's 352-789-9133. Wow. I didn't know that we're out of time. Dr. Summerton, time flew.
It did. Everybody, a beautiful day. Enjoy the sunshine, get some vitamin D, have some healthy food. God bless.
All right, thanks. We're going to have to work on Dr. Summerton's connection. All right, I want to thank everybody for tuning in and listening to Ask the Doctor. I'm Dr. Michael Lange. Go out and have a great day. Check us out on the web at drmichaellange.com, drmichaellange.com, or fortify.com. Have a great day. God bless you, and God bless America.